Hi everyone, welcome to classes webinar of this month. We brought a very interesting topic today, which is hollow chick made by HIFU. We have a different standards from Eastern and Western views. For example, for Western or Caucasian people has already a prominent arches for forehead and the zygoma and chins. But for Asian or East Asian people, we have a different kind of a wide zygomatic arch and a little bit flat the points of this western area. So most of all, augmentation for these lesions is important for making more clear kind of images for this thing. But for Western people like him, for frontal views, we have a different kind of shadows can make more the clear image or the masculine images and also the beauty side of the images. Or to compare the different kind of skull structures, you can see that which is wide and which is narrow. And interestingly, if you see Caucasian people, frontal shades and the frontal type of the shape is much more important to give the clear images. For Asians, it's in between the African and the Caucasians. The oblique side of the view, which is much important to make clear images, like 4-5 points of the face, making the clear images. In Africans, which is a little bit flat, and especially for the nasal area, which is important in a lateral view, is much more clear images. So how can make the hollow cheek with a clear point, the image point of the mid cheekbone? Usually the HIFU, if you are using get used to using the HIFU, already you have heard about the side effect, the complication of the HIFU. If you are delivering too much of the energy for the unintended side, you can see that the depression because of the removal of the fat tissues. It happens sometimes for the too much of energy is focused on a certain area. So why don't we can use this, making this kind of complication as an effective kind of a procedure? So as you know that the type of the energy is focused on the certain depths, and which depth is adjustable with our settings. So you can see that the depth of the transducers like at 1.5, 2 millimeters, 3 millimeters, 4.5 millimeters. So if you are aware of which kind of this focused energy is confined with, you can see which point will be decreased in the volume. Also, you can use the tightening with you are using this energy as a plane kind of a shape. So the focusing on the certain area of the volume can make the decrease of the volume. This is the key of these HIFU made in hollow cheeks. Actually, we can rise the temperature by the HIFU up to the 60 to 70 degrees, which is very enough to induce the apoptosis of the fat tissues. So, Unil process will happen after the HIFU treatment, which is firstly with the skin coagulation. Usually the coagulation happens in between the reticular dermis and the superficial fat area and the deep fat area, and the SMAS also together. And the wound contraction and the collagen synthesis will happen in the lower part of the reticular dermis and also in the fat compartment with the fibroceptors. And collagen arrangement will have a skin lifting effect inside the reticular dermis also in the SMAS area. But definitely it is the most important thing to make the fat tissue removal or fat tissue volume decreases. So this is a different kind of approaches compared to the conservative, a normal kind of HIFU treatment. So can we make the fat removal with the HIFU? Yes, because there are many kind of the references already we developed by the focusing of the HIFU energy in the fat tissue can make fat removal or the fat volume decreases. You can use the deeper penetrating the transducers or the deeper penetrating tips to focus the deeper part, like the body part or the tummy tucks. You can use this energy to decrease the fat volume. So if you can make the more precise treatment and more precisely confine the energy in certain depths of the skin or in the face, you can make the fat decrease. So how we can make it safely and effectively? Most important, first and the last thing we have to remind is facial anatomy, especially the structure of the superficial fat compartment and the deep fat compartment. Inside the mask, you can see that the deep and superficial area. So, to remind of the facial anatomy layers, we have 1, 2, 3, 4, 5, 6, 7 layers of the face. And you can see there are mass and the superficial and the deep fat area is divided by the mass. So, usually the HIFU-induced fat removal can happen in the superficial compartment mostly and partially in the deep fat compartment. It's totally different with the buccal fat removal by the conventional surgeries. So the hollow cheek, which is our target, will be is usually the under the zygomatic area in this area because it makes it a more shadowing effect to engorge the zygomatic, the 3D conformational structures, so make a clear images for this. So usually the 2 or 3 millimeter of the depth differences in between before and after. You can see that the middle cheek fat partially and the lateral temporal cheek fat mostly, and some of the lateral temporal cheek fat can be decreased. But usually it is just on the side of the parotid mesenteric fascia, so which is a relatively very superficial area can be treated with a HIFU. If you look deep inside of the face, you can see that the mesenteric muscles and the parotid gland is covering the masseter muscle lateral to the masseters, and Stenson duct is approaching the masseter, and the buccal fat is below and underneath the masseter. So the removing the buccal fat pad with the conventional surgery is a totally different approaches, which is very good for the removing whole the volume of the fat, but it will make a whole fat, the cheek area will be decreased. And sometimes if the skin laxity is too prominent, or if the patient is already very chubby, you cannot see that much of the result with only buccal fat removal. And you can see that the buccal extension of the buccal fat right now, and it can be approached by the HIFU also, but I think we don't recommend it cannot be necessary to remove this kind of buccal fat with the HIFU. Only this, with the medial cheek fat and the infraorbital fat. Medial cheek fat, you can see that the superior jaw fat, which is a little bit deeper portion of the fat. But usually, just underneath the mass is quite okay with using the HIFU, using the 4.5 millimeter transducers. But usually, in the deep fat compartment, the facial nerve branches and also with the other kind of small branches vessels cannot cross. So it should be very limited. So the SMAS and just underneath and above the SMAS with the facial fat compartment will be our main target. If you see that the buccal fat removal risk, you can see a very important injury to the salivary duct, which is very, very lethal and very critical the complication. And it is very hard to achieve with the HIFU. If you're using the very deep penetration by the HIFU, like a 6 millimeters or the 4.5 millimeter compression, maybe you can make it. But it is much more easier and much more safer compared to the these buccal fat removal surgeries. So you can adjust the energies and you can adjust the number of the sessions to achieve the proper kind of a depression by yourself. So once again, if you are dividing the cheek compartment, fat compartment, you can see that the middle cheek compartment and the middle lateral to cheek compartment, you can see the zygomatic area, and in this area will be our target. This one is a very interesting approach by the sculptors. Not only doctors and not only physicians, sculptors and the painters who studies anatomy also, They are interested. It is very interesting to describe this amount of differences when you are seeing the superficial anatomy like this. When you see if the weight gain is happening with the larger faces, you can see different kind of the fat portion of each compartment. You can see if you are getting chubbier, you can see the middle fat is much more engorged and the size increase in size, in width and in height also, which is important because this compartment is enlarged to cover all the zygomas and inside things. So usually when this compartment is too large, it is covering all the zygoma and is ruled out to laterally and downwards. So this compartment, like a nasolabial or the middle cheek compartment, sometimes it can be a target for the hypo treatment when you are treating the hollow cheeks. But it's not important thing because it is superficial fat path, so we cannot divide it in a certain area. So the importance is because if we are treating the number 4 and 6 in the middle cheek area, the lateral jaw area, you can see that we need to see the relation in between the parotid gland and the masseter muscles much more concisely. But this one, the nasolabial and the medial cheek fat is a little bit thicker, so we can approach a little bit the easier and with comfort for the chubby or the happier, the large face volumes. So when we are making the coagulation on the destruction point, we can see that the SMAS is located at 2.2 2 to 3 millimeters from the surface on the skin. So we can approach the 3 millimeters, 4.5 millimeters. The above and the under is the SMAS basically, but it depends how thick the skin is. Usually, when you are doing these procedures, the potential side effects include edema or the erythema or the tenderness, bruising, pain, and scarring. I think the edema and erythema always happening, which is a controllable side effect, but other things, tenderness and bruising, we have to decrease as low as it happens. And pain and scarring, I don't like this kind of a potential side effect. So to avoid this side effect, we need to approach the much comfortable ways by understanding the anatomies. We are not treating the no treatment zone or the conventional tightening treatment by the HIFU. We are targeting the under the zygoma and in front of the masseter muscles. And this one is not covering the Stenson duct and the parotid gland. So it is relatively safe areas. The only one thing we have to remind is the zygomatic branch of the facial nerve. It innervates the orbitalis oculi muscles and the middle cheek part of the face. So I will show in the hands-on practice. You will see that how we can safely approach this area by the pinching technique and adjusting the transdutal depth and the coagulation depth according to the skin thickness. You can see you can use the different cartridges types. Usually the main one is 2 millimeter and 3 millimeter, and sometimes you will need 4.5 millimeters. This lady, we have shadows here. I think it will be our goal to make this kind of makeup status without makeup. Okay, now we will make a little hollow to this beautiful lady's cheek. So we can detect the zygomatic arch here. And please say to the patient, say okay, and squeeze your teeth a little bit. You can find the masseter here. So check the masseter margins. Maybe you can just see that this area is covered with the parotid gland and the Stenson duct here. So our target will be underneath the zygoma here, this small triangle or rectangular shape of the area. So this one is a very small by 3 by 2 centimeters of the area. So we will focus on this. And if it is decreased a little bit, when you see from the view from the front, this one will make a natural shadowing. So this is our goal today. Okay, now we made a marking for the treatment here. It is about the 3 by 2 centimeter of the area, just below the zygoma. And there is a crossing inside for the very critical structures inside. But we need to know about that this lady's skin thickness is not so thick. Relatively thin superficial fat compartment, and also with the underneath the mass, we will have some of the deep fat compartment. So please make a pinch here. You can see around 1 centimeter of the depth can be pinched. And if you can just make a pinch like this with the 2 fingers, you can see safely treat this area with a 3 millimeter or 2 millimeter, and even with a 4.5 millimeters. So I think we can just do enough with the 3 millimeter and 2 millimeters without anesthesia first, and we can adjust the energy. I will use the 3 millimeter first with a 0.6 joules, and pitch the interval should be minimum at 1 millimeter. And because the 25 millimeter length is not necessary for this case, so we will just decrease by 2 in length. So shall we start? Okay, let me start with the 5 shots. You don't need to squeeze a lot. Okay, another 5 shots will be given. When you understand the anatomy and when you confine the target, it is very easy to treat because limited area you will repeat the procedure, repeat the shot in a condensed way. So if the patient doesn't tolerate the pain very well, you can just see the intervals because the accumulated heat energy will be just necessary, but or is not the essential. Okay, another go. Thank you. Okay. The last one. Okay. We made 30 shots of the treatment, and you can see some of the swelling happened here, but it is not so painful, right? Right now.
No, it's not.
Okay, great. It is just tolerable, so it is very easy to treat, and we will continue on the 2 millimeter treatment. It will be less painful. And the same one with a 20 millimeter in length and the 1.0 millimeter in pitch. We'll make another 20 shots of the treatment, so totally 50 shots for this area. Great. Okay. After the procedure, just the cooling is enough to decrease the swelling and the redness. That's all. We'll make another the side of the treatment. Okay. They place the line below the zygomatic arch and please say ah, E, squeeze. Okay. Check the margin of the masseters and target the area. We are not treating the anterior, the middle chip. We are just treating the lateral side of the middle superficial fat compartment. And turn your head toward. Thank you. Okay, by 5 shots intervals. How do you feel? If I squeeze like this, is it a little bit easier or comfortable or just the same?
Just the same.
Okay then. We are making jokes, and if you are a little bit chubbier, it will be easier. Okay, now we are making the turning point. Great. 10 shots more. Okay, last 5 shots. Great. Okay, let me see. Okay, perfect. Okay, last 20 shots of the 2 millimeters. You can adjust the depth if the patient is a little bit chubbier. You can make the 4.5 shot treatment when you're pinching the skin thickness is over 1.5 centimeters. You can go for 4.5 millimeters. But if it is just the starting point is if you are feeling comfortable, you can just start with the 3 millimeters. Okay, last one. And last three. Okay, after the treatment, let me see. Let me check if there is nothing critical happen. How do you feel?
Okay.
Okay. Do you feel any kind of stinging or
Yes.
something like that right now?
Yes.
Okay. It will be just the small redness coming here and the swelling here. It will be decreased, and we will apply some of the soothing kind of patches. Okay. Good work. Thank you. So what's interesting? We learned today how we can make the hollow chip with the HIFU. It will help a lot to make certain standards of the beauty. And I don't say that this one is one good single answer, but I definitely believe that it will be helpful for your practice in some ways. So hope you enjoy it.